All right, first question asks us to select a quote from our reading. I selected, "It is unrealistic to expect that a group will not involve risk, for all meaningful learning in life involves taking some kind of risk." I think this was a really important quote to me because we have to remember that any type of therapy is a risk for our clients. Our clients are having to feel trusting enough to open up their minds to gather insights that they haven't had before or who they have been running from. They also have to learn how to be vulnerable and how to discuss things that were difficult for them. They have to break family norms and family values, such as we don't talk about anything outside of the family house. And they have to have that trusting environment in order to do so. So they put themselves in a lot of risk, and it's terrifying. And as a clinician, you have to ensure that we develop enough rapport with our clients to understand how far we can take that journey with them. And we have to make sure that they're safe at all times and we reduce the amount of risk that they're exposing themselves to. I think this also falls into question 2, where it asks about competency as being an important part of social work, and it is. The NASW Code of Ethics states that social workers practice within their areas of competence and develop and enhance their professional expertise. Social workers continuously strive to increase their professional knowledge and skills and to apply them in practice. Social workers should aspire to contribute to the knowledge base of a profession. This shows that we need to be competent in all areas of group leadership. We need to understand the risks that our clients are taking. We have to understand and have the knowledge of what techniques to use when, how far to prod a client and to ask questions. We need to understand how to engage clients in group. If we don't have that competence, our groups are not going to be very effective. And it also helps us recognize boundaries in our competence. We're not going to know it all. We're not perfect. We are people. And we have to understand that competence comes with practice, with gaining of knowledge, with furthering communication with other professionals. We have to have those boundaries and know that we can only go so far too. If you are trained in a certain area and you have a lot of expertise in a certain population, you're going to best serve that population versus a population you don't have a lot of knowledge in. Number 3 asks, if you do not feel competent as you would like to lead a group, what areas of growth and steps do you need to take to build competence? Pretty much what I said. We need to be able to build our knowledge base, have a lot of support from other professionals in the field. We need to have a lot of practical experience, a lot of supervision time. I remember not feeling very competent when I first started therapy, and especially group therapy. I had one group in particular where 2 of my clients showed up intoxicated, and it triggered a lot of our other individuals, causing a very escalated situation that I was not competent on my own to handle. Luckily, I worked with a lot of professionals who had a lot of experience, and they taught me how to de-escalate that situation. But it was an area of that I was not very competent in, and I had to learn. And I learned through observation. I learned through being put in those situations and having to become assertive. But it did teach me a lot. It taught me how to set ground rules in a group, how to be assertive when ensuring that the ground rules are followed. The next part of this question, it asks, when do you need to consult other professionals? Well, all the time. I was lucky enough to work in a facility where I had co-therapists, where I had a supervisor who had experience in therapy, where I had a clinical supervisor. And all of them were always attainable to me whenever I had a question about a client, or whenever I was struggling, or whenever I could feel some countertransference occurring. They were always there to be able to give me another perspective, show me different techniques to utilize in order to help a client gain insight and help a client further in their therapy. The last question is, what can you do to avoid becoming culturally encapsulated group member? Experience. I do think it's the best. I think experience and knowledge, being able to gain knowledge of different populations, understand where their mindsets are, become just very educated in that group. And listen to your group members. Like, if you are going to do another type of group that you're not as competent in, really listen to their experiences. That can help us keep from just being a therapist in one particular population. I do feel that I work best with the addiction population, just because I have the most experience with them. I understand that population. through being able just to listen to my clients, through learning about that population, through reading AANA book, through just general knowledge, I feel like I'm the best equipped to work with that group. With whom do you work least? Well, I think with a lot of other populations, there can be a struggle just if I'm not too comfortable with that group, or if I'm not too informed about their cultural implications or what that population has gone through. I do find myself having a difficult time sometimes with very resistant clients who just don't want to do therapy, and they have no understanding of why they need to be in therapy. I think I struggle with those individuals in particular just because I want to help them and I can see a pathway to help them, and they're not listening. I had to learn over the years that you can only do so much. You cannot want treatment for them. You cannot want a better life for them. They have to want it. And I think in general, like, knowledge helps to prevent issues that bring up liability, because knowledge tells you how far to push your boundaries. Knowledge tells you how to implement techniques into group. Knowledge tells you how to run your group appropriately. Knowledge helps you with the code of ethics. Knowing your code of ethics keeps you very much in line with what is ethical practice for your clients and helps minimize risks for your clients. But knowledge also helps us understand that sometimes we don't know everything. We have the knowledge at that point to be able to seek out other professionals, be able to seek out clinical supervisors to get any advice or to get any insights that we may need as we embark on our new journey.